Time now for our weekly partnership with Asante. This week, Asante health expert Beth talks with Dr. Jed Reid about ACL injuries.
The ACL, or anterior cruciate ligament, is the most commonly injured ligament in the knee. The CDC reports the ACL injury affects as many as 250,000 individuals in the United States annually. Dr. Reid, who is most prone to an ACL injury?
You're absolutely right. The ACL is the most commonly injured ligament in the knee, or at least the one that I see probably the most. It is seen in patients and athletes typically that have a twisting or a hyperextension injury to the knee. It's seen in cleat sports like soccer and football. It's seen in court sports like basketball and volleyball. And it's seen very frequently in skiers of all levels.
And are there symptoms or warning signs associated with the injury?
Not much of a warning sign typically. It is a fairly sudden injury. Usually when the twisting or the hyperextension occurs, the individual will feel a pop in their knee and they'll notice swelling in the next day or so. And then as time goes by, not only will it be a deep pain, but the knee will feel unstable as well.
And are there ways to prevent the injury? And then how do you treat an ACL injury?
Prevention, wow, if we could figure that out, you think about all the athletes that miss time due to ACL injury, that's the million-dollar question, and there's a lot of research on that. There's some research suggesting that neuromuscular training and certain stretching and exercises can help mitigate against ACL injury, but these injuries occur in the most elite, strongest, flexible athletes in the world, and prevention is something we haven't figured out quite yet. And as for treatment, for those who sustain injury, if it's an older, more sedentary individual, you can often treat them non-operatively with a brace and physical therapy. But for the athlete that has healthcare goals and has motivation to return to the sport that often caused the injury, it's typically surgical reconstruction or repair.
Thank you so much for this information. It's good to know that if an ACL is injured, there are treatments out there.